Okay, I think we have enough people here to get started. Thank you for joining us today. We're going to focus today on hand hygiene and really rethinking the hand hygiene compliance process in healthcare. I'm Christine Corning. I'm a registered nurse. I'm still registered here in the Commonwealth of Massachusetts, and I had about a dozen years at the bedside and really across the continuum of care. So I've seen hand hygiene come into play in a variety of different areas throughout healthcare. That includes long-term care, ambulatory, med-surg, ICU, and home care. And each of those different areas of care pose a different challenge when it comes to maintaining hand hygiene compliance. So today to talk about those challenges, we have with us Sabrina. Sabrina, would you like to introduce yourself?
Yeah. Hi, everyone. My name's Sabrina Jiang. I'm a senior product manager here at Kontakt.io. In another life before I was a product manager, I also worked at St. Luke's Hospital in patient education, outpatient setting. So wasn't always in tech during all this. But specifically right now, I'm working with a lot of our clients to understand why hand hygiene is so important, how we can improve it. So today we'll be talking a bit about the landscape of all this.
Excellent. And obviously, why is hand hygiene important? We need to recognize that it has a massive impact on the health of our patients, the health of our staff, and financial impacts on our institutions. So whether you are focusing on HACs, which we'll refer to today, HAIs for acquired infections, nosocomial infections, it's all the same thing. We want to prevent any of these issues in the healthcare system that can lead to sentinel events, can lead to staff missing days of work, and the impact, of course, on the reimbursement in the healthcare system. So we're going to review all of these important key points today and talk a little bit about how we can start to improve that compliance over time.
Great. So to start with the patient perspective, which is really the most important part, according to the CDC, hand hygiene is the single most important practice in reduction of transmission of infection in healthcare settings. What this means in terms of numbers and stats is just in the US, 1 in 31 hospitalized patients has at least one HIA during their time. And in the UK, that number is even higher. That's 1 in 10 inpatients, which is a ridiculous number of patients, especially when we think about the fact that um, I think the stat across the board is about 50% of these infections can be prevented. So HIAs already are going to increase the patient cost of stay, they're going to increase the length of stay, and we think a lot about infection in terms of the health of the patient being affected. But that's not the only thing that happens to these patients. Patients are going to have to be moved to isolation rooms during to higher infection, which means that they, in studies have found, score higher on measures such as depression and anxiety and anger, and lower on satisfaction of care and perceived safety while within facilities. This then really affects how your staff is able to interact with patients and be able to deliver the highest quality of care. So to move over to the nursing perspective as well, we've talked a little bit about nurses being able to provide the highest level of care, but it's not just that, because as we found in recent time, 27% of the last occurring sick leave incidents by nurses were perceived to be work related. So we're saying about 1 in 4 sick days are because of work as opposed to other social work picked up somewhere else. So if you improve the hand hygiene and therefore decrease the amount of hospital-acquired infections from your patients, you're also reducing the number of sick days that your nurses could also have due to infections picked up within the healthcare setting. So all of this really makes a lot of sense in terms of quality of care for your patients, the perceived safety, how your nurses are working within your hospital, and satisfaction in the workplace. But a lot of administrators are going to ask, well, what's the financial impact of all of this? In the UK, HIAs cost 930 million pounds annually. And in the US, there's a direct medical cost of at least $28 billion each year. So that's just for direct medical costs. There's an additional $12.4 billion attributable to just society costs in terms of early deaths and loss of productivity as well. This is a ridiculous number just to think about in terms of you're going to a hospital to get better, to get healthier, and then you acquire another infection on top of it. So it's really a failure
Yeah,
on our part of everybody here.
I think, Sabrina, we all have at least personally or have family members or know somebody who has gone into the hospital for one thing and had picked up something else, picked up an infection or had some other type of complication that extended their stay or, it really impacted their care. So this is really important. Yes, looking at the dollars, but it's also when you think about the actual incidents, it's pretty impactful and something that needs to be addressed.
Yeah, definitely. And actually, on our next slide here, we can talk a little bit about what that impact is for cost and length of stay. So there's basically five big HIAs that everybody talks about. I've listed four here that we can really talk about the numbers for. So for central line associated bloodstream infection, the cost per infection on the medical system as a whole is 46,000 US dollars per infection. But what that actually amounts to in terms of the patient experience is that they have an increased length of stay by 11 days. And that's across the board, regardless of what you came in for. You could have come in for a surgery that only really needed you to be inpatient for, say, 7 days. And now you have an additional 11 days on top of it. That's insane. So then we can look at also SSI, surgical site infection, $21,000, 10 days increase of length of stay, or C. diff infection, $11,000, an extra 2 weeks of stay that they have to be there for, and then catheter associated urinary tract infection, $900, an extra 3 days. If we think back a few slides before, when we talk about isolation for these patients and the effect on mental health on other measures of just the cost and length of stay, this is a huge impact on the patient health and patient perception of services rendered. Yeah. So cost per infection and length of stay are great measures to think about here, but I think the next sort of logical question, especially you're working in the space, is, well, you may have heard of the hospital-acquired condition or HAC reduction program. And I don't want to spend too long on this part, but it's important to note that there is this program out there, which is a value-based program operated through CMS that allows hospitals to think about the reimbursement a little differently in terms of quality of care rendered to the patient. But one common complaint about the program is that it punishes the bottom 25th percentile of hospitals, regardless of if you have improved or if maybe on a whole we're doing much better about our HIAs in general. So just something to think about, something to be aware of. There's a lot of talk out there about whether or not the definitions for HAC is good or not, and maybe it should be improved for the future. So now that we have a sort of common vocabulary around what hand hygiene is, let's talk about how hand hygiene can be improved today. Nurse education is a big part of this. Every new nurse, every existing nurse goes through education programs probably annually. And the thing that you're going to hear most often is the 5 moments of hand hygiene. So before coming into contact with a patient, you want to sanitize your hands, performing a clean or aseptic procedure, after exposure to bodily fluids and glove removal, after contact with a patient and their immediate surroundings, and after touching an inanimate object in a patient's immediate surroundings, even if there were no direct patient contact. I want to pause here for a moment, especially around like how people can be reminded of these moments. Because I think for a lot of people who've worked in healthcare, number 2 and number 3 are sort of second nature. At this point, before you're doing a procedure, you're going to sanitize. And like if anything touches you or you're removing your gloves, you're going to sanitize. There's that sort of nudge there already as part of education we have. But in the hubbub of a healthcare setting, number 1, 4, and 5 may be a little harder to remember because maybe a patient asks you for a cup of water. And so you bring that cup over and then you've just done something else. It's in the mess of everything, 100 different things you're doing right now. It's not as memorable or as a habit as the other two, which we think of as sort of traditional healthcare practice.
Yeah, and Sabrina, to your point, I think a lot of times when a nurse is entering a room, it's because something's happening. Maybe a monitor is alarming, and the first thought is the patient. So the first thought isn't necessarily to stop, wash my hands, and then go address the patient, see why the monitor is alarming. If there's some sort of an incident, or if it's just a lead that fell off, whatever the case may be. But it is really difficult to have that state of mind where you're going to pause. Your immediate action is to go right to the patient. And I think a lot of times that's where the hand hygiene is missed.
Yeah, definitely. And I think you mentioned earlier during COVID, during like these unprecedented times, there's been a lot more awareness about hand hygiene. But in the last few years as well, we've also had an influx of patients coming in, especially patients who are scared, who don't know what's going on, who are in a hospital setting for the first time. And under the pressure of multiple patients yelling for different things and the hecticness and being understaffed, there could just be moments that are just harder to remember all the little details.
Exactly.
Yeah. So, um, as we think about that, we have nurse education, of course, is a big part of improving compliance. But how do you get visibility into compliance? A lot of infectious disease prevention programs send what we call a secret shopper to quietly observe nurse hand hygiene in the workplace. So someone who's not part of their department or ward walks in and observes for a day. They have a little clipboard and they're there. This is really in quotes because it's not so secret and
I was going to say, not very
everybody knows.
secret at all.
Yeah, exactly. Um, One of our nurses in our nurse advisory group had said that when this happens, usually there's a text chain that happens, and
Mm-hmm.
everybody knows beforehand that today is the day that this is happening. And so all the sinks are clean, all the refills have been done on the dispensers, like they know exactly what's happening. But this is the thing of the dichotomy. Everybody knows what hand hygiene, or like a lot of people know what hand hygiene is supposed to do and the importance of it and how often we're supposed to maintain it. But on a day-to-day basis, it may not be the top of their list because, well, the patient need right at the moment, procedures given, etc., just are so much more important to push out there. The other thing I want to talk about here for the secret shopper method is this effect called the Hawthorne effect, which is the concept of when you are being observed, your behavior changes. And so there was a meta study done on how the Hawthorne effect, especially in hand hygiene, has changed the behavior of nurses. And they found that hand hygiene compliance increased anywhere between 3.4% and 65%, which is quite a wide
Wow,
range
that's a lot.
in terms of compliance.
Yeah.
Yeah. And so, how do you really know if your staff is doing the right thing on a day-to-day basis? Like, because if it were a predictable amount, like say every time you observe them, it always increases 10%, that's very reliable in terms of a measure. But with such a big range, you don't really know. And so it's complicated for administration to understand what's happening.
Yeah, and I think it's important to know all of the people that are going in and out of these rooms, right? So
Mhm,
even though we're focusing somewhat on nursing here, you have providers, you have med students, you have visitors, you have, and it's really difficult to reach that level of attainment across everybody that's entering the room, whether it's dietary or therapists or whoever
mhm,
is providing care or contacting that patient. So I think that leads into, why is this so hard?
mhm, definitely. Um, so some common feedback we get from out in the field are, as we pointed out before, nurses are really busy. And we're saying nurses here because a lot of this webinar is focused on nurses, but
Mhm.
really all of your staff in healthcare are incredibly busy. There are a million things to do, and there's not always clarity on what the priority is of the million things to do. And so your headspace in different places, and maybe this is the thing that falls into the cracks or out of your head about things. And not just thinking about your healthcare providers or your staff, your clinical staff, there's also we have to think about supply chain and environmental services as well. Because if your hospital uses the alcohol dispensers, then maintenance of those dispensers and management of dispensers are incredibly hard. Do you give the refills to the nurses and tell the nurses to refill the dispensers? But that's taking a lot of time out of their day that they should be providing patient care to something that's more of a maintenance task. But of course, that's an administrative decision. Do you then decide, okay, my clinical staff are going to do clinical things. Instead, I'm going to hire environmental staff, and they are going to be in charge of refills as well. That's well and good. Now you have separation of concerns. But then the question is, how does your environmental staff then have visibility into when a dispenser needs a refill? Your nurses are probably the people who have the best visibility into that, but then taking time out of their day to then call environmental services, get someone here, they don't know when they're going to come. It's all very hard. Never mind to think about broken dispensers, or if you have automated dispensers, which are usually better for hand hygiene because you don't have to touch a physical object, but now you have batteries to think about. Um, so all to say, there's a lot of things as we move into a more tech-enabled world of concerns to think about. And the final part, which I think may not be the most top of mind for nurses, but placement in dispensers is incredibly important. I think, Christine, we've talked about convenience of sanitization.
Mhm.
And if you don't have a sanitizer within the room, then do the nurses use the one in the hallway? What if it's like 50 feet down the other way? Are they supposed to tell the patient, hey, hang on a second, I know you're yelling, but let me go to sanitize my hand before I walk in? Or do they now have to carry sanitizers on on their person as well? It's just
Yeah, and
more
that's
than
a
they
really
start to
good
think about.
point from a patient perspective too. If I can't see you washing your hands and I don't know you did it, then it's not going to give me the confidence that it's been, that it's been taken care of before you come to give me some care.
Mhm. Exactly, exactly. Um, so all of these have like number one and two or bullet points are just about how do you actually enable compliance in the first place. But then we want to think about the flip side of this is how do you know that initiatives you're taking in hand sanitization is actually working? So if you have a traditional method of your dispensers are on the floor and you're going to use a secret shopper, then your visibility of compliance is actually quite low because the number of days you can really observe a single unit is maybe in the single digits of days that any unit is operational. And if you're a large health system, how do you scale this out into multiple buildings, multiple campuses across different states? Maybe even if you're an international service, how do you scale across different countries? It's a lot of manpower to then send out there. And so we have to think about how that is hard for administrative point of view. And then the final note here I do want to emphasize is on reward versus punishment. I think there we got a lot of feedback, especially from our advisory group, on the fact that everything feels punitive for nursing staff. They get told all the time, why can't you do this better? Why aren't you doing this now? We've educated you on this. Why isn't this done already? And I actually have the next quote on this from a nurse advisor group member. The department thinks that you're under stress or you've overworked because you've had like 20 admissions more than your average day. Let's throw a pizza party to reward you. But the pizza party is not the answer.
We
If
all
you've
love
talked,
pizza, but I mean,
yeah, but if every single time you're supposed to be rewarded
yes,
for something, it's pizza party, it's
yeah, it
not
loses
the
it.
answer. Yeah. Um, and so there's a few different things at play here. I think the sort of more joking answer is, well, please don't give your nurses pizza all the time as the only
Mhm.
way to reward them. But the other part is pizza parties maybe only happen once a quarter, maybe once a year when you do reviews. And so are we really expecting our staff to be perfect for 100% of 365 days before they see that you acknowledge their effort in this? And I feel like that's like if we think about habit formation, that's not the way that this works. You want rewards faster at 30 days, 60 days, 90 days, and constant acknowledgement of their efforts. Um, so rewards in general get left out a lot. The more cognizant health systems are doing something, at least there is a pizza party. But I think there's further work that can be done on this.
Well, when you look at the numbers around the hospital acquired disease conditions and the money that can be saved, if there is in fact improvement, I think it definitely equals more than a pizza, right? So we should look at what are those reward systems, and how can we make it more tangible for the nurses, and really have a bigger impact.
Yeah, definitely. Actually, just to go back a few slides a little bit, this of course ties back into visibility of compliance. If you don't know how compliant you are, then you may not be able to give rewards out there. But as we all know right now, there is a nursing shortage. There is also unhappiness with the workplace right now. A lot of nurses are considering moving outside of healthcare space. So how do you bring back the joy of working in healthcare? How do you make sure you convey to them that you acknowledge their efforts and that you value their efforts? So all of this is sort of tied together into initiatives that can help with improving hand hygiene. So as healthcare systems are thinking about the path forward, what we would encourage you to do is ask yourself some of these questions and think about them in terms of holistic implementation of improving hand hygiene. So we've talked a lot about making the process rewarding and fun as opposed to punitive, but instead of thinking, my nurses in this department have not met this target yet, think about how do you give positive feedback? So maybe you can look at change or improvement month over month as opposed to just a goal orientation of it. Going to use this tagline here of nudge, not shove. Trust that after you've educated your nurses, they know what is right. And what they need at different times is just a gentle reminder that they are doing the right thing. Don't have huddles in the morning that go, and you didn't sanitize your hands properly. I saw this yesterday. Like, don't make them tattletales. I think we've learned this from elementary school, not to do that.
Yeah.
Yeah.
It never works. And also, if you're going to have an accrediting body, or your CNO or your chief compliance officer present, then there's going to be improvement in compliance, right? But that's not always the way. In that secret shopper method, it's just never going to provide the results I think that we're looking for.
Mm-hmm. Yeah. I think the secret shopper method is maybe a good way as you're considering your options to get a baseline, or just before you implement another initiative, something you can do as a stopgap solution. But in terms of scalability and also impact in the wider space, maybe not the best. Cool. So on the administrative perspective, you should be asking, how do you gain insight at a specific department level, at a building level, at a campus level, or throughout your entire enterprise? Are you able to get the granularity that you need, but also be able to zoom all the way out into seeing trends over time at a larger scale? Then you also want to think about how environmental services may play into this. Whose responsibility and role is it to make sure that the right sanitization options are available at the right times? We've talked a lot about dispensers during this because, well, for most patient interactions, you want to use alcohol or you want to maybe use a sink. But of course, there's other standards for hand hygiene, depending on the infection or the patient isolation. But there's a lot of moving parts then to all of this. Think about how the supply chain and the processes work here. And then finally, how does this all come together into one big initiative? Because it's all good and all if you have insight of hand hygiene compliance at just the department level, or you have compliance for nurses. And it's all great if somebody else on another side talks about environmental services, but you want to think about this as a holistic initiative and holistic solution. So are you able to see if environmental services is down a person on one side, or dispenser management has not been done in one unit, that impacts the infection rate somewhere else? All of this comes together into one thing that improves your financial outcome, improves your nurses' happiness, and improves patient care. So you want to think about this all together. Great. I believe that wraps up on our side. Christina,
Thanks,
hand it
Sabrina.
back
That was
over
a
to
lot
you.
of great information, and it all seems such common sense. And we've been talking about this for years and years and years, and how, of course, we need to wash our hands. We need to remind our providers and physicians and everybody who comes into the room to wash their hands. But it does have so many other moving parts, like you said: environmental, time, workload, the the education, which I think, we can't rely solely on education and say, hey, I showed them an e-learning, they should be washing their hands. It really has to be a holistic approach to how do we attack this from three angles, right? Like you said, department, building, campus, all of the different ways that we can fix this problem, and to kind of look at it as less of a punitive thing and more of looking for those rewards. So we do have a couple questions if we have time. The first one is, how do we recommend that we monitor compliance? How do we get to that granularity?
Yeah. So starting from options that we currently have, we've talked a little about the secret shopper and the pros and cons of which, just to recap really quickly, secret shoppers are a solution you can use if you want to be able to deploy really quickly, because that's just a person goes out there, observes people. You can get data back really quickly on maybe what are the problem areas. Another part you may also want to do some research or just take catalog of is dispenser placement and dispenser availability. So that's the flip side of, we think of secret shoppers as just like the actual compliance, then availability of resources is somewhere else. These are all things that you could do even next week if you want to try it, because it's just about manpower. If we then want to go up in terms of maybe more automated or tech enabled, then you can think about working with partners. There's a lot of dispensers on the market these days that record when a dispense event has happened and could tell you on a room level or on a staff level how this works. But there are definitely tech options to explore on this as well.
Yeah, and let's not forget, just ask the nurses what would make it easier for them. Like, what is their blocker? What is causing, where are they seeing the biggest challenges in their day-to-day workflow?
Yeah, definitely. And especially take into consideration that different departments have very different workflows. Your nurses working in the ER or anywhere else where you have patient bays as opposed to rooms are going to need different placement of dispensers. You don't have as many walls in these areas. So maybe they need to be freestanding, whereas your nurses in more inpatient situations may need different needs from you.
Excellent. And here's a more fun question. If we're not going to do pizza parties, what do we recommend for rewards?
Of course. So as we talked about with pizza parties, it feels like sort of a big thing, right? Because you need a lot of time from your nurses. It's going to be probably an event. You put it in a room somewhere, or you need to make sure nurses are available. There are going to be many people staffed during this. That's part of why it may not work. And I want to highlight like why pizza parties don't work to talk about the solutions that may work. Some of our clients have done just sort of, I won't call it social engineering, but I'm going to call this just visibility to their peers. I think as a group of people, your clinical staff are people who want to do good in the world, and they take a lot of pride in providing the best patient care experience. And so if you want to show this on a leaderboard somewhere of improvement, then you can. And this could also lead to maybe more regular gift cards, whether you want this to be like a coffee gift card or down to the dining hall or somewhere nearby. Maybe there's a donut place that everybody loves in the area. But the idea is that you want to give visibility and value more frequently to your staff so that they also feel like you are looking out for them in a way that's not just like once a year, I'm going to look back on this and be like Santa Claus if you're on my naughty or nice list. It shouldn't really be that way.
That's a good point. Great. Well, I think that's really the end of our questions for today. I want to thank everybody for joining us. And Sabrina, this was great information. Again, it seems like such an easy fix, but there's so many aspects that go into it. And I think we need to really consider all of the different challenges that we face and make sure that we are praising more than we are than attacking our staff on this. I think that's a very, very important piece. We obviously saw a huge compliance during the pandemic. Some of that is starting to taper off a little bit. So let's make it always important, not just reactive to something that's happening in the environment, whether it's a global pandemic or something within your hospital. In just being proactive versus reactive, I think is always going to benefit our healthcare systems in the end on most things, but certainly when it comes to hand hygiene. So thank you. Sabrina, do you have any final words before we sign off for the day?
No, not really. I think you really summarized it great.
Okay,
Thank
great.
you.
Well, thank you again, everybody, for your time, and we appreciate you joining us.
Yeah, thank you all so much. Have a great day.